introduction. And thank you for participating. Of course, this is an orthopedic surgery meeting, but the sports medicine should be part of the orthopedic surgery. Just to give you a very brief background of myself, I'm working in probably the largest orthopedic hospital in Europe, in Zurich, at the Schultes Clinic. We have 14 operating theaters. They are running every day, and we perform approximately 21,000 surgical interventions, the entire spectrum of orthopedic surgery, including deformities. I'm mainly related to the spine unit with the service which we do in the triage. So I'm, since more than 30 years, working very closely with the orthopedic surgeon. I understand what you are doing. We try to support the orthopedic surgeons as much as possible to reach the better results for our patients. As a part of my past, as was mentioned, 23 years as a FIFA Chief Medical Officer, so I have learned the world of sport from the very close by perspective and learn a lot for my profession. Earlier this year, in July and August, I participated not at the World Cup in Russia, but I participated actively at the Football Medical World Championship, which was in Prague, in my home city in the Czech Republic. And it's an interesting competition, 22 teams with more than 1,000 active participants from around the world. This is the Czech team, quite cool guys, most of them orthopedic surgeons. They are meeting every week, they are training, and they actually made the second place in the World Championship. They lost against England, but they beat it before Brazil and outpost the team of Brazil. I think the Thai team of the doctors should consider to participate in the future. I know that you are very active. Dr. Paisal, who introduced me so kindly, and it's a friend of mine since many, many years, I think you should take the initiative, because the doctors, they play a very important role. And it was my philosophy in the past with FIFA that the world of sport must empower the doctors to make the right decisions in favor of our athletes. Here I'm a picture of aging doctors in Denmark. I think the Thai doctor has a better position in playing, so I think you are entitled to participate in the World Championship 2019 or maybe 2020. But let's come back to the medicine and science in sport. I had the privilege to present the new ideas and also the results, facts and figures to the FIFA congresses over decades, and I think it impacted at least some of them who were not corrupted or just striving for fame and money. From our hospital, 2 years ago, we have sponsored or established a full professorship at the Swiss Federal Institute of Technology, which you have here in front of you, very famous academical institution, actually the #1 in Europe. We have established a chair with scientists related to physical activity and health. This is a major step to get more information why sport is medicine, why should we use it more extensively, even more in the future. We need to do it because we need strong arguments to persuade the governments, the ministries of health, ministries of education, to do something about this fact that half of the population in Europe never exercise. Can you imagine? Half of the population never exercise. No wonder that most of them are suffering of cardiovascular diseases, the diabetes is on rise, and other lifestyle diseases. We have to change it. I think we doctors are responsible for them to put the governments under pressure. And if we take it in the course of the time, In the past 30 years, since 1975, actually it's 40 years, till now, there is a strong rise in the obesity around the world. And particularly the dark red line on the top, that's Southeast Asia, the high-income part of the population, the obesity and all the related lifestyle diseases are on the rise. We have to change it. While we are getting fat, not me, but some of the people are getting fat. We know that a regular exercise, and that has been clearly proven, only 15 minutes a day, and that's just fast walking or a couple of staircases to do, will make an impact on duration of your life by minimum 3 years aside of quality of life. Just 15 minutes exercise a day. The better muscles you have, the better survival rate of you as an individual. Those with low muscle strength or even the sarcopenia, they just die earlier and they die under much worse conditions. So what are the health effects of the exercise? Definitely, and I start from the brain as a neurologist, there is an improved mood and cognitive function. We have even indication now that a regular exercise will delay the development of mental diseases, dementia, and even this, what we call Alzheimer's disease. But we definitely have a strong scientific evidence that the cognitive function, even in the 7th, 8th, and 9th decade, will improve with regular exercise. We will enhance the oxygen uptake, and as a side effect, there will be weight loss. We should have an optimal body mass index. We will reduce the cancer incidence. There is a strong evidence from the different publications, and you have seen I have published a lot, so anything what I say is backed by scientific evidence. Reduced cardiovascular risk factors, and of course cardiovascular diseases. Reduce bone loss during aging, particularly in women. I am spine specialist. Vertebral fractures of aging women is one of the main problems of mature women. And it could be tackled by regular exercise, but you have to start before you have the first fracture. Then it's usually almost too late. So we have to start much, much earlier, and I will provide you some of the evidence. And of course, muscle strength and all this, the local muscle adaptation. Now I will share with you some of our experience from research studies. A close friend, collaborator, and associate, Peter Krustrup from the University of South Denmark, we get together since 2000 and designed a long-term prospective studies, basically using the same methodology which we initiated very early. We take unfit population, different ages, men, women, children, and so on, and then we randomize them in 2 groups. One is going intervention, and one is continuing the same life as before. A classical study design of randomized clinical trial. We did a number of studies, altogether with 21,000 participants. Just those who did some prospective randomized studies will acknowledge the fact 21,000 participants, 8,000 of them were children. The studies were designed to effect of fitness on health, effect of fitness on performance, and effect on skeletal muscles and the energetics. So basically, different studies which we were trying to get an information. We assessed virtually every bodily variable you can assess with machines, with laboratory, with documentation, DEXA, whatever you ask for and whatever the research question was, an appropriate set of investigation was done. Just a very brief video clip how it looked like in the field. That's a population of aging women, aging men, children, obese women. VO2 max laboratory, DEXA, strength, jumping force, cognitive function, concentration. Just few results. They are now 135 original publications since 2008 when we had the first one up to 2018. A huge body of knowledge, huge body of evidence which we should use to force the responsible in the countries to do about the fact that half of the population is inactive. So in the men population between 20 and 40, again the same design, 3 months of regular training, and we used football because we thought that football is one of the very useful and important means of improvement of physical fitness. So we were testing the change of fat percentage, muscle mass, and bone mass, bone density. And we compared at the very early studies jogging, football, interval running, strength exercise, and control group. And football was just far better, significant better than any other means. So the fat percentage went down, the muscle mass increased, and bone density increased. The same for women, and this is particularly comparison of football, jogging, and control group after 3 months, and this is the important age group of women for build-up and strong bone density. Already after 3 months, there was an increase of bone mineralization already at the age group 20 to 45-old women. We use now and prescribe football clear as a therapeutical means to tackle or treat hypertension. Whatever origin of the hypertension is, of course we are not denying medication, that's clear. But there where you see the borderline, you have at the age population of 40, 50 years old men or women, and you have the systolic blood pressure 135, 140, and the diastolic 85, close to 90, then start to exercise. Because already after 3 months of regular exercise, your blood pressure will significantly drop down. That's the cheapest medicine you can apply. And you reduce significantly the risk of onset of later on problems. A paper which was recently published in the British Journal of Sports Medicine a few months ago, that was a systematic review and meta-analysis of the papers which we have done by an independent group. And the conclusion was in moderate hypertension in the middle-aged population, physical activity will drop the systolic by 11 millimeters Hg and 7 millimeters of the diastolic. That's sensational findings, but you have to do it. At glance, and this is my most favorite slide, we compared 70 years old unfit or fit footballers with the 30 years old unfit men. And the results, here are just 2 examples. The muscle force and muscle strength of the 70 years old trained footballer like Dr. Paisal is the same as a 30 years old untrained young man. Some of you orthopedic surgeons in the new generation, because you work too much, you might be in this group. The same is in the coordination, muscle coordination and others. Like the 70 years old, same variable as the 30 years unfit. So 70 years old footballer are as healthy as 30 years old men who don't train. Keep it in mind. And we have number of papers published on this subject, so it's worth. So at glance, what has been proven? If you do regular physical exercise, for example, by regularly playing football 2 hours a week, you will increase your maximum oxygen uptake by 10 to 20%. You will have decreased by the blood pressure by 10 millimeters Hg. You will decrease your body fat mass by 1 to 3.5 kilogram. You will increase the muscle mass, on contrary to 1.5 to 2 kilograms. You will increase by 2.5% the bone mineral density. That's very important. 50% improvement of postural balance. And again, for you orthopedic surgeons, how many cases you had of an aging woman falling down in the shower or in the bathtub with breaking her hips because of osteopenia or osteoporosis? How many have you seen with vertebral fractures because they have fall of postural imbalance? They fell and already such, and if you can improve the postural imbalance by regular physical exercise, by training, you will avoid, you still will have enough work in the future, but definitely the improvement of postural balance will impact particularly your field. You will improve or increase the psychosocial well-being, the cognitive functions, which again is quality of life. Just at glance. So in summary, football fitness, or I would say general sport fitness, is medicine against lifestyle diseases, is effective for everybody, young and old, men and women, fit and unfit, poor and rich, and independently of skills and experience. And it's never too late to start. So even the aging population you can motivate to start. So where it comes from, all those ideas? We have decided 2003, and the science works slowly. You need long time to create really and sound evidence to evaluate whether football in comparison with other sports have positive effects on fitness and health. And after more than 15 years of research, with comprehensive testing of more than 21,000 subjects, participants, 13,000 children and 8,000 adults, we published 135 peer-reviewed articles in different international journals, and our answer is clear: yes. So if you want to know more, you can just go into the literature. You will find all those articles. For children in particular, and I think we are just developing ideas with Dr. Paisal and his crew, that we impact positively the negative trend of your children getting obese. Obviously, Thailand is ranking number 2 in the world ranking of child obesity after Mexico, and number 3 is United States. So you have to do something about that to tackle this issue. And maybe football, as the most popular sport, is a means to do that. We could bring the football in schools twice a week, 45 minutes, or 3 times 40 minutes per week, to lower the risk factors. It's not so difficult, and I understood that your Ministry of Education has a policy: teach less, learn more. And the time they save for teaching should be used for the physical exercise for the kids. We developed this, what Dr. Paisal mentioned already, the Football for Health. In a nutshell, analyzing the most important risk factors leading to diseases in the childhood and adolescence, develop health messages while playing football, get a couple of stars to promote those messages like Cristiano Ronaldo, Neymar, Messi and others. They all are willing to support us because they understand their social responsibility for their success. So we could revitalize the discussions with your officials we started 2 years ago. And I remember very well that the lady in the middle, the skinny lady, the Ministry of Health, she was quite excited about this program. So I think maybe it's the time, and use also the opportunity why I am advising the Prevention and Wellness Clinic in Bangkok with the BDMS network, could be used as an opportunity to use also my time efficiently and contribute at large to the country with improving the health of the future generation of your country. So no doubt, exercise promotes health, most likely any type of exercise, as long as one adheres. You have to do it regularly, and you have to for yourself. Exercise is boring, except football, which is a social activity to a certain degree. Peter Krustrup will have in January a meeting in Denmark, so those who are interested, I encourage you maybe to go and listen to the up-to-date message in Denmark on football is medicine. It's really one of the major movers. I consider him as one of my students or collaborators, and it's great that the activity is continuing unrelated to the governing bodies. We doctors, scientists, have to take the responsibility and continue. So thank you for your attention, and I think now it's time for discussion.